Hello and welcome to the Parkinson's Foundation's Care Partner Summit. I'm Krista Ellis, your host for today's program. We're so grateful to have you here. At the Parkinson's Foundation, we're deeply committed to addressing the needs of not only those living with Parkinson's disease, but also those who walk this journey alongside them. Through innovative care, impactful research, and community support, we strive to enhance the lives of everyone affected by Parkinson's. In today's webinar, we will hear from an expert in the field, and our panelists will share what they have learned and offer effective tips and tools that support everyday challenges. The Care Partners Toolbox may include tips for self-care, strategies for building support networks, and enhancing communication skills. Share in the chat the essential tools and resources that have helped you. To begin our formal presentation, I would like to introduce our presenter for today's webinar. Originally from Adana, Turkey, a city renowned for its delicious kebabs, Ece Bayram has dedicated her career to advancing research and education in Parkinsonian disorders. She earned an MD and PhD from Ankara University and completed research fellowships at the Lou Ruvo Center for Brain Health in Las Vegas and the University of California, San Diego. Ece Bayram's work focuses on understanding how factors such as sex, gender, ethnicity, and race influence Parkinsonian disorders. Her research is supported by organizations including the National Institutes of Health and the Lewy Body Dementia Association. Beyond research, Ece Bayram is passionate about raising awareness, supporting the community, and mentoring the next generation of scientists and healthcare professionals. She has held leadership roles with organizations such as the International Parkinson and Movement Disorder Society, the Alzheimer's Association, Lewy Body Dementia's Professional Interest Area, and the Lewy Body Dementia Association. In addition, she actively volunteers for local and international programs aimed at supporting underserved populations, providing education, and advocating for better representation in science. Dr. Bayram, thank you for sharing your time and your expertise with us today.
Thank you. That was a lovely introduction. So I'll try my best to do justice. All right, so I'm excited to kick things off with a quick presentation before we head on to the more exciting part of today's chat, our panel discussion. So to start things off, Krista already mentioned, but I have research funding from National Institute on Aging and Lewy Body Dementia Association that basically keep me in this field, keep me working. And I just want to start off with this disclosure too. The things we talk about today, the things you hear today, may or may not represent your experience. I don't want you to leave today's talk thinking I'm abnormal or my experience is weird. Or maybe everything will speak to you and you'll feel I'm so normal. It's absolutely not our aim today. We're going to share our perspectives, and some things may make sense to you, some things may not make sense to you, and you may have to come up with your own way of things too. We just want to provide you with some options and our perspective today. So please hear our chat with keeping this in mind. So we're going to talk about some practical tools and strategies to support the care partners caring for people with Parkinson's disease. And we're going to really emphasize the importance of self-care. We're going to hopefully get you to think about some effective communication strategies to navigate difficult conversations, and also touch on the importance of planning for advanced Parkinson's disease needs and tips for supports. So I really like this figure from this paper that was led by Dr. Blom. So Parkinson's disease management takes a village, and central in the care of Parkinson's disease is not just the person with Parkinson's disease, but also the family and the care partners that are providing the care and support to their loved one with Parkinson's disease. But the problem is, majority of the caregiving in Parkinson's disease is by unpaired unpaid caregivers, usually family members like their spouse, their child, and no one's trained from birth to become a care partner in their lives. Even someone trained to do caregiving as a job is not trained to do it 24/7. They also have, non-work breaks. They also have their personal life. So it's not easy. And caregiving, caring for your loved one with this disease starts even before they get a diagnosis. A lot of the times when you're in the process of getting your loved one a diagnosis, you're usually the history provider. You're usually the one who pays attention to the symptoms, shares what they know with the doctor, and helps out with the management plan to carry on their daily lives too. And just as someone's life changes after hearing a diagnosis of Parkinson's disease, the care partner's life changes as well, because they're going to have their own journey with Parkinson's disease as they care for their loved one. And care partners for Parkinson's disease can be involved with many, many aspects that impact their loved one, including their daily life activities, maintaining their safety, managing their medication, and making sure they're still engaged in life. But unfortunately, a lot of care partners experience burden, and both motor and non-motor symptoms of Parkinson's have been associated with this level of burden, and things change over time too. Parkinson's disease keeps evolving as time goes by. People experience different symptoms get worse, and as the symptoms get worse, people with Parkinson's may rely more and more on their care partners. And as each person with Parkinson's experiences different symptoms and different progression rates, their needs may differ too, and the care partners coming into play may be differing in what they provide for their loved one. While our first priority is always protecting our loved one from further harm, maintaining their safety, someone caring for Parkinson's disease also have to pay attention to helping them maintain their independence as much as possible. A lot of the times when we're caring for a loved one for a short term of sickness like the flu, the cold, etc., we, keep them as comfortable as possible. We help them out. We make sure they get their rest. But with Parkinson's disease, that's not the case. You have to support them to actually do things, continue to do things on their own, continue to keep their independence as much as possible for a very long time. But at some point with the disease progression, things are going to change, and you may start being concerned about their safety. You may need to start using assistive devices or bringing other factors into play. And at that time, when that time comes, it is important to not do everything on your own, but actually bring it up with your provider to discuss the options for the best assistive devices, what advanced care planning will look like. Discuss it with your loved one, with your healthcare provider, and start, building your plan for the future. And also remember, Parkinson's disease impacts behavior and cognitive skills, decision-making skills, and with disease progression, these problems are more likely to occur, which means you may have to have the hard conversations very, very early on in the disease course. Honestly, in my personal life, I think any adult should be having these tough conversations from the get-go. You should know your loved one's preferences for how they want things to be managed when they're unable to function on their own, when they are going through end of life. I think you have to know what they expect, what they want, and vice versa as well. Your loved one should know what you want for your end of life, because having Parkinson's disease, of course, puts you at a higher risk of having more issues, more accidents, and dying eventually with the disease. But there's no guarantee you're not gonna suffer from something before that, and there's no guarantee that we're all gonna outlive our loved ones. So these conversations need to occur very early on in your life as adults in the disease process to allow them to know that they're the decision maker. They still have that control in their life. And for you as well to, you're not second guessing what they would have preferred. You're not guessing, oh, they would have preferred to kept, hooked to the machines, or they would have preferred to be going at their own pace, etc. These are tough decisions. A lot of the times, your family relies on you to make the call. So you have to think about those, be prepared for yourself as well. Be prepared, alert your loved ones, people around you. Have those tough conversations from the get-go. It's not beautiful. It's not an exciting conversation to have, but it's a need. We all have to have our advanced care planning wishes in place. So with the disease progression and as people are losing their functionalities and their independence, we may need some help from assistive devices. And it's tough. It's not easy for someone to accept that they're no longer independent. They need assistance from a device that's not theirs. So while for us at times it may feel like, okay, you're falling, you're experiencing problem with your walking, why won't you use an assistive device? It's hard for people to let go and accept that truth. So even though we have all these options, just be mindful. It's not easy for someone with Parkinson's to accept a new device that they're going to have to rely on 24/7. But there are options. It may take a while to adjust to these different options, but luckily there are options. And I'm not going to go through all of these individually in too much detail because I want to leave a lot of time for our amazing people on the panel. But I do want to point out falls are really, really important in Parkinson's disease. They're amongst the biggest causes of death and disability. And there's a high likelihood eventually in the disease progression that someone with Parkinson's disease is going to fall, probably more than once. So you have to be prepared for a fall, and you have to learn a safe method to help your loved one get up from the ground. And for that, the first thing you do, even if you don't get anything out of today's talk, I just want you to remember this. Someone with Parkinson's disease, they have a high risk for falls. If they fall, don't panic. Just as, you would fall or someone without Parkinson's could fall, the first thing you do is you don't panic. You take your time as needed. You check for injuries to, put together a game plan. If they have any bleeding, any injuries that you're concerned about, call someone, call for help. But you're not seeing any injuries, they're still talking just fine, they don't feel any pain, let them rest. You're not in a rush to get someone up the ground super quickly. Let them rest, let them get comfortable. If they're able to get up on their own, give them some solid piece of furniture, object to help pull themselves up. Because, they may still be feeling dizzy, but they don't realize it. Just make sure they're holding on to something solid. If they're wearing a transfer belt, you can help get them up with a firm grip, but make sure you're also safe and you do it at the same time with them. It's not like, I'm going to pull you, just get up whenever you need. You go together to get them up. And if it's unsafe, a lot of the times we see Parkinson's impacts men more and their wives are helping take care of them. And sometimes the wives are petite. They're not able to get their husband up. Don't do it. Don't injure yourself as well. Call for help if it's unsafe. You can call for a neighbor to help, for a family member to help. Take your time. Just make sure you're not causing any more harm to them and yourself. For standing and sitting, be mindful of the seats you have around the house. Have a chair with sturdy armrests, stable base. This is going to help with getting up from that fall too. And just for everything with Parkinson's, don't rush. Take your time, let your loved one take their time. Remember that these things that are automatic for people without Parkinson's is no longer coming automated to people with Parkinson's. So it's a constant new learning experience for them. So you may need to constantly remind them how their body should be moving while they're getting up and sitting down. Eating and drinking is also really, really important because we see swallowing issues with disease progression, and it's one of the leading causes of death in Parkinson's disease. And to avoid any of these swallowing issues causing problems, you basically have to remember, all right, things are not going to come automated. The muscles aren't going to move as they would for someone without Parkinson's. So you have to, go through that learning experience over and over again. While eating, taking medications, whenever someone has to swallow something, pay attention that they have an upright posture. They're not, eating something super big. It has to be in bite-sized portions. You may need to pay attention to the texture of the foods at times. People with Parkinson's may need to change their diets, and it may take a while to adjust to a new diet too. Don't give up hope. You may need to try so many different options when you're changing a diet to find out what your loved one enjoys, prefers. Don't be like, oh, they didn't like this first thing I tried, so it's just not going to work. There are so many options for the diet changes for people with Parkinson's, so keep trying. And also remember, at times you don't like a food if you try it now, but a year later, you try it again and you're like, oh, this is actually good. That can happen for people with Parkinson's too, they may have to go through a diet change because of swallowing issues and they try something, they don't like it, and then they try different things, they still don't like it. Go back to the first thing. After a while, maybe they may start liking it. You never know. So be patient, keep trying for that diet change. Pay attention to hydration and make sure your loved one with Parkinson's is getting hydrated. A lot of the times, people with Parkinson's don't get hydrated and they don't want to drink water. So you may need to force them to actually get hydrated. You may need to follow them to make sure they're getting the hydration they need, and pay attention to weight loss. Sometimes you want to lose weight. That's great. But sometimes, people with Parkinson's, they're inactive and they're losing weight even though they're not active. That may have to do with the diet problems, the swallowing issues. So pay attention to that. Using the toilet, bathing are areas that we carry a lot about because we experience a lot of falls during those things. Remember and remind your loved one with Parkinson's, accidents, having a urinary accident is much better than a fall. You can clean things up. It's embarrassing. It's not like awesome. You don't want that happening. People don't feel good about themselves when it happens, but it is much better than a fall. Just keep that in mind. You can clean anything. You can help your loved one take a shower, clean their clothes, change their clothes. But if they have a fall, risk for injury, it's just not worth it. Don't rush. So to avoid that rushing, you may create a regular schedule, even if they feel like they don't feel the need to go, just stick to that regular schedule so you don't have that sudden need to rush to the bathroom. And just like standing, sitting, and walking, you have to pay attention to sitting down on the toilet seat, getting up from the toilet seats, and also the surroundings. Make sure everything is within reach for people. While they're taking a shower, a lot of the times, people with Parkinson's, they want to maintain their independence while taking the shower, and they can. You can, use some assistive devices like installing the handrails to the shower tub, making sure there's a non-slip mat, making sure there's a chair in the shower. You can help your loved one with Parkinson's maintain their independence while they're taking a shower by these small tips. And, there's a lot of different tools we all use right now. You don't have to have Parkinson's, and they can come in very handy for people with Parkinson's, like the electric toothbrushes, electric razors, the hands-free hair dryers. So, take advantage of these things. I use them all the time too. So it doesn't necessarily have to do for help with someone with Parkinson's, but why not get the assistance from them? For dressing, just like everything else, make sure you leave enough time, you're not rushing your loved one. And if they can, let them do the dressing. I know a lot of us, we just want to help our loved ones and not make them go through difficult, challenging situations, but it is important to help them maintain their independence for as long as possible. So just give them enough time. It will take longer, it may be difficult, but if they're able to do it, please don't take any tasks away from them. Let your loved one with Parkinson's do the things on their own as much as possible. Travel and transportation. So many people with Parkinson's can drive safely for a very long time before or after their diagnosis. But at times, because of cognitive changes, behavior changes, motor problems, or medication side effects, safety may be compromised when someone with Parkinson's is driving. And you may need to pay attention to that. And you may need to bring it up with them, with the healthcare provider, to make some adjustments. But be ready for frustration. It's a tough conversation to have to, make someone realize that they can't be driving anymore. And that is kind of why it helps to have these conversations from very early on in the disease. So you're aware, this may come up. Eventually, you may not be able to drive safely. And it's for your own safety and also for the surroundings. The last thing you want is to drive unsafe and hit someone and affect someone else's life. So be mindful of these. These may be in your future. Have these conversations. And also just be mindful that driving is a big independence. So losing your ability to drive, getting your license taken away is going to cause a lot of stress, a lot of frustrations. It's not easy for someone to lose their driver's license. So maybe before, going through that, keep in mind that there are also other options to help maintain that independency to an extent for traveling, transportation. A lot of the local organizations help out, supports people that are unable to drive with rideshare services. Seek those out. Mention that to your healthcare provider. Get in touch with Parkinson's Foundation. They may have some resources to help out with that and guide you in your local settings. If you're the one driving, going somewhere with your loved one with Parkinson's disease, make sure you have enough time. Don't, even if you're going to be gone for a short amount of time, always take the medications with you, just in case. You never know, you may end up staying there longer. Make sure you have some liquids, some snacks, be prepared for any kind of accidents, just in case. And give yourself time too. A lot of the times, if you are helping your loved one go somewhere else and they have to have a walker, you have to be mindful of what you would need to transport that walker or that wheelchair. So give yourself some time too. Take advantage of the services available to you at airports, at different transportation modes. There's usually assistance available. There's nothing wrong with using them. Just give yourself enough time, inquire about what is available, and take advantage of them. Medication management is something that people with Parkinson's rely a lot on their care partners for. I know this very personally from my own grandparents. My grandma was she was illiterate. She didn't know how to read and write. So my grandpa had to keep track of everything. And he did a stellar job. I always felt like he did a much better job than even doctors, keeping the list and making sure how things work for her, etc. So make your life easy too. Use the tools available for the medication management, use the pill boxes to make things easier for your loved one with Parkinson's and yourself. Store everything in a secure place. You don't want to have any accidents with your loved one taking too many medications or someone else in the house utilizing those medications. Keep track with alarms. A lot of the times people with Parkinson's have to take their medications pretty frequently, and you experience problems when they're not following the schedule. So, keep track with your smartphone if you have one, or timers at house if you have one. Whenever you're leaving home, carry those pills with you. And also remember that at times some medications are not safe for people with Parkinson's, and some medications interact with Parkinson's medications. So don't just take a random medication on your own if your loved one, gets an infection, a cold, a flu, etc. Don't just give them any medication. Check with your healthcare provider to make sure that it's safe. Skincare is something really important for people with Parkinson's and something we usually neglect. So be mindful of that. Check the skin regularly for any changes. Use lotion to moisturize the skin. And remember that, people with Parkinson's experience problems turning in bed, things you probably don't even think about doing when you're sleeping. People with Parkinson's experience those issues, and if they're unable to move too much on their own and they're sitting, they're not going to move around too much. So make sure you're moving around, helping them change their position pretty often to reduce the risk of any pressure sores. Because once you get a pressure sore, it's really hard to manage it. So just pay attention so you can prevent getting those. And just remember, there's so many things you can do for your loved one with Parkinson's, but caring for them, caring for your loved one is going to take a toll on you. We know that from a lot of the research studies that are coming out, that it has significant impact on the care partners. And this impact can differ from person to person. You may get two identical people with Parkinson's disease and same symptoms, same severity, same daily life restrictions, and their care partners may experience completely different impacts. It has a lot to do with who you are, where you come from, where your loved one comes from. For instance, I'm Middle Eastern woman, so I was kind of raised in that culture where women are supposed to be the caregivers. So whenever something happens to my parents, between me and my brother, I usually pay attention to things, keep track of things. It's just in our norm. I don't see it as a burden necessarily. It's just, what I was raised with, what is expected from me. But it may look very different in another culture. And if something was to happen to me, the burden may be a lot more on my brother, and he may react very differently than I would. So keep that in mind. Just because you're seeing other care partners experience things worse, better than you, doesn't mean you're the odd one out. The impact just differs. And there's a lot of reasons why this burden happens while caregiving for a loved one with Parkinson's. It's not an easy disease. No one, knows what to expect with this disease. We have an idea about what may be to come, but there's no guarantee anyone's gonna get the certain symptoms, the progression rate is gonna look exactly like that. There's no guarantee. It's very unpredictable. It fluctuates. It may look very different from day to day or even within the day. And It's tough to see your loved one going through losses. It's not easy on you as well. And if you already had a great relationship with your loved one, having a disease come into play, it changes things a lot. And, you may have to say goodbye to that past relationship and build a newer one with your loved one. It's not easy. And just as your loved one with Parkinson's is going through their own adventure, you have your own future with them, with them going through Parkinson's disease as well. And, you have to keep in mind that the journey is not easy for you as well. There's a lot of uncertainty about your own future. You may feel the need that you need to spend more and more time to provide better care for your loved one, and you may isolate yourself from the others. You may lose your freedom just as your loved one is losing their independence, and you may start sparing less time for your own well-being. But it's not all bad. It's not like the caregiving is the worst thing in the world. No, there can also be positive aspects to caregiving. Of course, no one wants a disease, if I'm sure if you could choose, you choose for your loved one to not have Parkinson's, but if it happens and if you're providing care, it's not the end of the world or it's the worst thing that could happen either. A lot of people with Parkinson's and their care partners actually experience a stronger relationship with one another, and the care partners may experience, more personal growth with this new role in their lives, and as they're making their daily life more structured for their loved one with Parkinson's, they may appreciate having that more structured daily life as well. But we have to pay attention to care partners' needs, just as we pay attention to your loved one with Parkinson's disease's needs. Depression, anxiety, health issues are common for care partners of people with Parkinson's disease, and it doesn't just happen overnight, it builds up. So you can first start experiencing caregiver stress, where, stress, anxiety levels are manageable. You feel stressed, but you're able to function, you can carry on. And it can start getting worse. It can start getting less manageable and actually impacts your ability to provide care. And eventually can get to a point where you experience that exhaustion. You may have a change in your attitudes that goes from positive and caring to negative and unconcerned. And as you can imagine, caregiver stress is the easiest to manage out of all these. So you want to make sure that it's not progressing all the way to burnout, where helping address that is way harder than stress or strain. So for that, we really, really emphasize self-care, the importance of maintaining your well-being so you don't get all the way to burnout. And remember, self-care does not mean selfishness. Caring for yourself, putting your priorities at a decent level in your life too, does not mean you're ignoring everyone else and just caring about yourself. No, it means that you're putting your needs on the same level as your loved one. A lot of the times, people with Parkinson's disease that I get to spend time with share their concerns for their care partners. They share that, hey, they changed their life for me. I really appreciate it, but I think they're, stressed, they're depressed, they're anxious. I think I feel like a burden to them. So you have to be mindful that, your loved one is worried about you too, even with Parkinson's disease, even though they have their own journey going through a tough disease, they care about you still. They may not show it, they may not share it with you, but they care about you still. So you have to make sure you're in a good place and you're paying attention to your needs, just as you pay attention to the needs of your loved one. You can identify what causes that stress for you and, think of ways to help control those emotions and release your anger. Once you get your loved one a diagnosis of Parkinson's disease, it's a, big change for you as a care partner. And it's okay to be angry. It's okay to be upset, frustrated. you don't have to look, we've got this covered, we've got this figured out. You don't have to look as stoic, you can break down, you can be upset, you can be angry at life or at this disease. It's okay, but you have to express that. You may have different ways you prefer expressing that, all up to whatever you prefer, but make sure you're getting those feelings out and you're not getting them just locked inside of you and not sharing them. Don't neglect your social needs, and don't just spend time with your loved one with Parkinson's disease. At times, your loved one with Parkinson's disease needs a break from you as well. So, give yourself a break, pursue your hobbies, do things that excite you, that you enjoy, because you still have a life too, and you have to maintain that life. You got to be open with family and friends. It is not weak to ask for help when you need. And remember that you learned a lot of things along the journey with Parkinson's. So someone coming in to help you may not know all those things. And you may feel like, oh, it's just better that I do it myself. It's easier for me to do it myself than actually tell someone else how to do it. No, it's not. Train someone else, tell someone else, okay, this is what works, this is how I do it, and let them take care of some things. And at times they may have some, ways of taking care of things that would be helpful for you as well. Maybe you didn't think of that before, maybe they bring in another perspective and you can get benefit from it. If you feel like you can't really relate to your family and friends and you need someone that goes through a similar situation as you, seek connection within the Parkinson's disease community. Parkinson's Foundation offers amazing resources to support people living with Parkinson's and also their care partners. Take advantage of those. Don't isolate yourself to only your environment once you get this diagnosis. You can grow your environment within this community as well. And sometimes, people want to help. They ask you, okay, what can I help with? When, you get suddenly hit by that, it's hard to come up with things. And you may have an idea about, okay, I need help with this, that, but when someone asks, it may just go poof. So take notes and keep them handy. If you are using a smartphone, keep the notes on your phone. So when someone asks like, hey, I'm free this week, is there anything I can help you with? You can tell them, hey, actually, I need help with groceries this week, or could you spend time with my loved ones so I can go to this bike club this week, etc. So keep those handy, take those notes, be prepared when people ask you for help so you can actually give tasks for them to do. Don't ever feel embarrassed to seek professional help or counseling. Mental health is a part of your body health, just as you're seeking help for your loved one with Parkinson's to help manage their Parkinson's disease. If you're experiencing any changes in your body, your mental state, you got to seek help too. There's nothing embarrassing or wrong about that. There's nothing that makes you weaker by doing that. It actually takes a certain type of strength to be open to seeking help and to acknowledge that you need help. Honestly, I've been in therapy for years and years, and I feel like with or without any pressing mental health problems, anyone would benefit from, getting professional help. There's nothing negative about it. It's only positive. Sometimes it helps to know more about the disease, that you feel more comfortable and you know what may be in the cards for the future, so you can plan for the future better. So use resources available to you. Parkinson's Foundation really has great educational resources. Check those out. Help educate others around you too, so they know what to expect with the disease progression with your loved one with Parkinson's and how they can help support you in your caregiving journey. And have those conversations from the get-go, very early in the disease course, so you can plan for the future when your loved one has all the amazing skills they have readily working, functioning well early on. Exercise, exercise, exercise. As we always say, exercise is the best medication for Parkinson's, as far as we know. It's really important for you to maintain that exercising regimen too. You have to stay on top of your own health. If even if not, if you feel like, oh, I don't think I matter that much and I should not put myself first. If you have any health issues, that's going to impact your caregiving skills and, make things worse for your loved one with Parkinson's. So you got to stay on top of your own health for them, even if you don't care about yourself. And with that, I'm going to move it on to our panel. And thank you so much for sticking with me for this quick presentation.
Thank you, Dr. Bayram. Really appreciate the way that you've outlined some of the essential things to plan for, to look towards, and to consider as a care partner for someone who's caring for someone living with Parkinson's disease. I'd love to invite our panelists, Lori, Tom, and Barbara, to join us for our conversation now. And we've opened the chat, so if you are here as a care partner or as a person with Parkinson's, please share in the chat a tip or a tool that you felt has been essential in the navigation of this journey with Parkinson's. Welcome, Tom. Hello, Barbara.
Good afternoon.
Good afternoon. Good morning. It
Hi.
could anytime across the world right now. So grateful for all of you joining us to share your experience in the Essentials Toolbox of caregiving. So would love to just do a quick round robin so everyone here can get to know each of you. Tom, if you would kick us off, maybe share a little bit about yourself and your journey with Parkinson's.
Sure. I've been a care partner for about 18 years. My partner was diagnosed with early onsets. We live in Columbus, Ohio, and so we've kind of learned a lot over the years and try to spend as much time as we can with family that live in the Ohio area.
Love Ohio. Thanks for sharing, Tom. Lori, how about you?
Hi, my name's Lori Russell, and my husband was diagnosed 6 months after we got married. He was also early onset back in 2005, and he had the disease for 18 years. He recently passed away, and he had a courageous fight with it. He was a big advocate within the Parkinson's community, and it was, we can't thank enough the Parkinson's Foundation for all the help that they gave us during our journey with this. And we just want to give forward everything that we learned to be able to help spread the knowledge that we gained.
Thank you, Lori, for sharing. And I'm grateful of the connection that you and your husband have had and the impact that you continue to make on the community here. So thank you for being here.
Thank you.
Barbara?
Hi, I'm Barbara, and I'm in Denver, Colorado. My husband of 56 years was diagnosed in 2017 with Parkinson's disease. He's a Vietnam veteran. He was exposed to Agent Orange when he was in Vietnam. We are both ambassadors with the Parkinson's Foundation, and that has given us strength. Everything that we give, we get back doubly, triply, quadruply. It really helps us as well as reaching out to other people.
Thank you for sharing, Barbara. There was a subject, Dr. Bayram, that you addressed on this idea of asking for help. And many care partners find it difficult to ask for help, even when they know they need it. And what personal strategies I'm thinking or insights may have helped each of you, Tom, Barbara, Lori, and anyone who'd like to share in the chat. What has helped you to overcome the challenge of asking for and also receiving help? And how can we create a culture where seeking support is seen as a strength rather than a vulnerability? Yeah, so I'll open the floor if anyone is feeling the itch to share.
You know, something that I wish we had known about in the beginning that we use now was palliative care.
Mm,
And if we had known about it when Gary was first diagnosed, I think it would have helped us so much with dealing with the suffering that we went through. And we've been in palliative care now for a few years, but that helps you to ask for help too, because you strategize together, you set goals together, you think about what do we need to accomplish this. And so some things that may have looked very difficult maybe a year ago are seen differently just because of having that help to strategize and set goals together.
thank you, Barbara. And Dr. Bayram, would you be able to define palliative care for our community here?
Oh, I get the tough questions. Palliative care is basically a specialized medical care that focuses usually on like serious and chronic illnesses. It doesn't have to be end of life level of care. You can start it from very early on in the disease process. It's basically another level of supports, and it covers many, many aspects of the disease. You know how like neurology is more focused on the brain related stuff. Palliative care offers a more holistic approach. So it is a specialty, you know, a further specialized advanced care.
Yeah.
And yeah, and it's a great source that at times a lot of people aren't aware of. They don't know about because their provider doesn't bring it up at times. And, you know, you don't know about all these different departments in the medical field, etc. So you're not able to get out yourself, but it is something available for people with Parkinson's to help them prepare for the future, manage their daily lives.
That's helpful, Barbara. Thank you for highlighting palliative care. I know that there is a certain taboo idea of palliative care, right? And there has been a shift in the medical field of how we approach palliative care to be supportive and, as Dr. Bayram alluded to, the more strenuous, more chronic progression of diseases or illness. So highly encourage everyone to check out what palliative care is. And I saw we have a volunteer in the chat who just put some information there. Tom and Lori, do you have anything to share or offer insights on what strategies have helped you overcome the challenge for asking for or receiving help?
Yeah, I think what I actually did is ask my partner for help. We got into a situation and a routine where he did less and less, to the point where I was doing all the cooking, all the cleaning, doing all the grocery shopping, you know, basically managing the household. Well, he still was able to do some things. He uses a walker to get around, but you know, you can use Alexa to put a grocery list together. You can do some meal planning. You can make dinner once a week. You can, Friday nights, he's in charge of figuring out dinner. I don't care where it comes from, what it is. I have one day off. I don't need to worry about that. So that really did change things, because then it was getting him thinking, him using the skills and abilities that he still has and that he could do. And, you know, it made him feel better about himself, where, you know, for a period of time, I was doing all the meals, the meal prep, the cooking, and then I was frustrated because I was doing it all. He has someone come in and clean the house once a month. So yeah, I'm not doing it every week myself and taking care of it. So that was really kind of an eye opener for us, and not to let us to get to one extreme from the other. And that really helped me. That made me feel like he is a partner in it, that he was participating, and 100% of the burden wasn't on me. So that was probably the biggest shift that we did, which I didn't realize at the time, when I probably yelled it out of frustration one Friday night after cooking 100 meals in a row. That really has been very, very positive for us.
Tom, what I'm hearing is you said the thing. You said the thing that you needed to say and that you needed help with. I'm frustrated. I'm doing too much. Help me. And you also celebrated your partner's skills of still being able to do these things with your patience and your kindness and empowering them to do the thing too. You said the thing and now he's doing the thing. It's so, I want to celebrate how you said the thing and now they are doing the thing. So it's as simple as that. And that was something that Dr. Bayram was saying. It doesn't need to be hard. Let it be easy. And the more that we're more easy on ourselves, we're easy on others. And what are some ways that we can make this day a little bit easier? And I'm applauding you, Tom, and saying the thing. What are you having for dinner Friday night?
I don't know, but I'm gonna enjoy it.
That's right. That's right. Thank you, Tom. Lori, anything to add as far as the challenge of asking for and receiving help?
Yeah, somebody gave me great advice during our journey, and that was think about how great a gift it is when you are able to help someone. And by you not asking somebody to help you, you're depriving them of that gift.
Mhm.
And once I started having that mindset, it alleviated a lot of the guilt that I felt of asking for help. And it was like the burden just really was alleviated from my shoulders. Like I felt guilty asking my children, hey, can you spend time with your dad? I really need a break. But I was depriving them of time with their dad.
Mhm.
And so when you have that mind shift, remember you're giving people a gift. My husband had a huge social network, and they wanted to do so much to be with him and whatever. And they came out of the woodwork to help with, so like I had to do a home renovation in order to make my house wheelchair accessible. And I literally had 50 people show up at my house to rip out the front of my house, to put in a wheelchair ramp, a new door, everything. These people came out of everywhere to help myself and my husband. And they want to help. They love
Mhm.
you.
Mhm.
And just know that you're giving them a gift as much as they're giving a gift to you.
Mhm.
Lori, the idea of receiving help or giving help is a gift for someone else is such an important thing to say, because I am absolutely the helper type. You need help? What can I do? What can I do? Please let me help you. Let me help you.
Exactly.
Mhm.
It's like I feel wonderful when I do something for somebody. And think about depriving that
Yeah.
for somebody, because there's so many of us are givers,
Yeah.
And we are giving too much sometimes as caregivers, and we need to spread the wealth, okay? Spread the wealth to others.
Let someone else help.
Exactly.
They
So think of it as you're giving gifts to others. You're giving gifts.
want. Thank you for sharing, Lori. I want to share this comment that Phil just wrote to us in the chat. And they say, I guess I should not dissuade my partner from house cleaning. Food prep can be a challenge just because of cognitive difficulties, but I'll be happy to turn over the vacuum cleaner. That's great, Phil. I'm glad that you're taking that away. And Kathy writes, it takes a village. It does. Really want to ask a couple more questions, and we are going to go over a little bit a few minutes. So raise your hand if you have to go right at the hour. Okay, like it. I'm loving it. Thinking about balancing and what Phil just alluded to here, what sort of approaches have you all found that helps you balance your loved one's independence, so maintaining that independence that Dr. Bayram had shared with us during the presentation, with the need to step in and help with daily living tasks? So there's this phenomenon that I witness in caregiving relationships of, just let me do it. I can button your shirt faster. I can tie your shoes faster. I'll go to the grocery store. I can get it done faster. At what point do you balance the independence of your loved one and also feeling that need to step in and support them?
It's a hard one. I think it all depends on your stress level,
Mm.
is what I always
Mhm.
found. If my stress level is off the charts, I'm much more to snap and say, let me do it.
Mhm.
But if I take a breath,
Mm.
I'm like, all right, I'll see you in 10 minutes.
Mhm. Mhm.
And you have to acknowledge that your stress is going to dictate how you deal with giving them their autonomy and their independence. So
Mhm.
don't let your stress level take away all the things that they can do in their life. Don't
That's a
take away.
such a good point, and I think reminding ourselves that they feel our stress,
Mhm.
and so taking a breath, like you were saying, Lori, being patient, allowing enough time, and noticing and asking the question, do you need my help with this? Can I help you with that? And Gary will tell me, no, I got it. But then I have to be patient and give him the time to do it, and allowing extra time to get in and out of the car when you're going someplace. Some of the things that Dr. Bayram brought up before, but communicating about it. Do you need help with this? Can I help you with this? Really makes a difference for us.
I don't really have that specific issue right now because he's pretty independent as far as getting dressed and taking care of himself. But one thing that I noticed, kind of to Lori's point about stress, is if we're leaving the house at 1 o'clock, then at 12:45, I'm like, hey, remember, we're leaving in 15 minutes. And, of course, in Yarrow's built in extra time because it'll take time to use
Mhm.
the bathroom, get your coat on, get out to the car. And I know if I'm rushed, then that doesn't help things. So I
Mhm.
always build in extra time when I can. And then it's a nice leisure walk out to the car and then we get going. And that's been very helpful.
That's great, Tom. And Lori and Barbara, thank you for sharing. Dr. Bayram, anything to offer as far as managing the balance between independence and offering support?
I think it's very tough and it's very personal, what you're used to, what your loved ones used to. So I think it's just a personal, path, but you have to remember, like, you have to have that empathy and put yourself into their position and remember, how would you prefer
Mhm.
things get
Mm.
handled? If you would still prefer doing the things on your own, even if it takes you so much longer, even if you need some help, but you would still prefer to do things on your own, let your loved one do things on their own too. Don't rush, don't put that extra pressure, but
Mhm.
give them the space, support they need, but let them do things on their own if that's what you would prefer as well.
And I think remembering that they need to move. We were reminded of this last evening where we were watching a movie and Gary forgot his water bottle. It was in another room. And I said, oh, do you want me to get it for you? He said, no, I need to move. I need to get up and get it. It's good for him.
Good for him.
Yeah, and you can stay on the couch. That's great, Barbara. And congrats, Gary, for saying, I need to move. And he did the thing. He did the thing. He
Mhm.
did the thing. Um, there's a question that's coming up that there's a common thread in a lot of the questions that we're receiving from all of you watching today, and it's conversing through communicating to and with your loved one on a sensitive subject, whether that's they're having trouble hearing and are in denial about needing a hearing aid, or struggling with incontinence and really in denial of needing to find support to help manage the incontinence. So I'm really curious, Dr. Bayram, please feel free to chime in too, Barbara, Tom, Lori, if there are any tips that you have on holding those hard conversations with compassion and being able to navigate those difficult conversations with your loved one.
I used to go to all of his doctor's appointments with him because I found that the doctors would ask questions and his answers would be different from mine. And I'm like, well, wait a minute, you don't do that. So I found that to be helpful with some of the hard conversations, because then it did, on the ride home, it would be like, I was shocked to feel like you thought you were doing A, B, and C. So that helps us come up with different solutions. I was concerned about his driving, but he took a driving test and he passed it, and he went to physical therapy and they, helped him with those things. So that was also helpful in that way, and having that discussion, because the doctor was like, okay, Tom, you think, he's having issues with his driving. Well, then let's send him to an impartial third party who signed off on him being able to drive. So that helped. That's just one simple example, probably.
I think there's a lot of stigma surrounding certain things. It's considered embarrassing to have incontinence, to have accidents, etc. I think it's important to have speak about it and normalize it and remind people that it is the disease. It's not like they decided to get a disease, go through all these symptoms themselves. It is the disease that is putting them in this position. It is not their fault. And it happens to all of us, even with or without Parkinson's disease. I'm sure all of us have gone through, accidents where you're like, oh no, that wasn't what I expected, etc. It happens. It's not abnormal. We don't bring it up, we don't mention it, but I think it's really, really important just to have those conversations, start normalizing things, and also be okay with that frustration too. Let people get frustrated. It's not easy to have such symptoms. If they're mad, let them be mad. Be mad with them. Yell at Parkinson's with them. Express your anger with them as they're going through these frustrations too. At any family gathering, it's a very big taboo to have mental health problems in my culture. I bring it up. I bring up therapy. I bring up my process. So it's becoming normal for them because they keep hearing from me about these things. So, start having these conversations, start normalizing things. Maybe check out some documentaries on, Parkinson's or other diseases, so you can show see, this person also is going through some similar things. You're not a weird one, you're not abnormal, and it's the disease, it's not you.
We went through oh, I'm sorry, go ahead, Lori.
No. Go on, Barbara, go on.
Well, we went through something last summer that now is different this year. And some things just take time to get there too, in terms of processing what you need and how you're going to use it. We were doing some traveling last summer and the airports were long, and we had to get a wheelchair for Gary, even leaving Denver that day because of stress. And it was very painful for him to have that. And we continued to need that, but he did not want to do that going in and out of other airports. And I had to say to him, I realized one day, it just occurred to me, I just took a breath. I thought, what is it? What do I need? And I thought, no, I need the wheelchair for you because it's too stressful for me. And we're going to have more fun at the other end, and you're not going to be tired. And he got it. He said, I get it. So just recently, we were in palliative care. We were talking about traveling, and he said, I realize now I need a wheelchair in the airports because I don't need to make myself that tired. And I want to have fun at the other end. So that was a process that took place over time, partly us talking together, but also him processing it himself and giving him the time to do that.
I'm glad you brought up travel, Barbara. There was a question from Dee asking for some tips in travel. So there's a little snippet for you, Dee, and I saw that Laura gave a little resource for you to refer to as well. Lori, did you have something to share?
Yeah, one of the things that with Parkinson's, there's so many little losses that the Parkinson's patients goes through, and their pride gets hit so many times. And as the care partner, we have to be so we have to have so much empathy when we're dealing with these little losses, and some of them are so personal. With the incontinence, with the loss of driving, It can go also with, the loss, in a relationship with sexual side effects, which is a huge, big taboo, but we have to deal with these issues, when it's a husband and wife, husband, wife situation that we're dealing with. And we have to have these difficult conversations. And if we have the empathy that it's not you, this is Parkinson's. This is a Parkinson's thing that is happening. It is not you, and I love you still. And we're going to get through this together. And we're going to find ways to do it so that your pride is intact still. And I will work with you through this. But you each go through each of these little wars that Parkinson's puts you through, and but you do it together, and you work with your doctors on it, and you can get through it, and you can, like, we got stronger through it every step of the way. And but it's hard, but counseling, like the doctor said, it's invaluable. It's absolutely invaluable to help you through each of these little griefs and each of these little wars that you're going to go through with this disease. But you can fight these battles. And Parkinson's Foundation has the tools to help you get through it. And they have these offerings in order to help us through it. So thank you again for offering these things for us.
And I think a lot of the things we're talking about today is definitely tied back into self-care. And I know people aren't fond of maybe that term self-care and what is self-care, and they get frustrated by that. But exactly what Barbara said about the wheelchair, that was self-care for herself. It was a simple act. It was an easy thing. And now it's a routine. When we travel, we call the hotel ahead of time and we get a roll-in shower. We arrange the wheelchairs in advance. We check to see if the hotels have a headboard so he can roll in the bed and grab onto the headboard, as the doctor alluded to earlier. So those are all just tiny little snippets of self-care that you're probably doing every day or every week and you don't realize it. So, just give yourself a little bit more grace because you're already doing those things. And as you hear these different conversations, you're going to pick up a little bit more and more tips, and it's just going to become second nature.
I think that's so important because we make these adjustments as we go along without really thinking about them. And then when we sit and think about them, like as you were just enumerating those things, Tom, all the things that you've done that you've probably done gradually, just automatically because they're needed, and you don't even realize all the adjustments that you're making.
Yeah, and that comes to the subject of resiliency and adaptability that we started this Care Partner Summit webinar series on. And Tom and Barbara and Lori, you all are an example of what it means to live resiliently and to live adaptably. I'd love to, we're 10 minutes over time, and I want to respect everyone's knowledge and time and everyone who's still joining us. There's still quite a few participants here, obviously gleaning a lot of support and information from this conversation. So I'd love to ask Tom, Barbara, Lori, Dr. Bayram, what's one thing, one tip, one tool, something that you've done, you have found is essential in your role as identifying as someone who cares for another living with Parkinson's disease? How do you support? What's one thing? Go ahead, Tom.
Well, I was shocked to learn that my partner needs time away from me. So, that was one tip. I figured that was not the case. So that was very informative. But for us, I think like starting off the work week, I go to work on Monday morning. So for us to kind of chat, maybe at dinner on Sunday, okay, what appointments do you have this week? I'm going to be home late these days. This is what's happening for dinner this night. So for us, just to make sure we're on the same page, we use a shared calendar. And then we have an idea. Of course, things change and pop up, but it kind of gives us a little bit of a blueprint for that week. We just do little chunks, 5-7 days at a time, so it's not too overwhelming. But that helps me. Again, that's an example of self-care for me. Then, oh wait, I didn't know you were working late that day, so now I need to shift this or whatever. So that would be a quick thing for me.
Yeah, family meetings is what I'm hearing, Tom. Family meetings. Thanks for sharing.
We check in with each other every week. How are things going? how, and also planning ahead, like what Tom was saying, we have a shared calendar as well, but just checking in, how are things going? How are we doing? Are there things that we would like to do differently together or individually? And I would say in that regard, remember you're a team. Remember you're a team, and remember to have fun. To have fun, to have things to look forward to have things on your calendar that you can't wait to have happen. And even if you might have to adjust them or delay them a bit, have things to look forward to and have fun.
That, Barbara. Thank you for that suggestion of having fun and checking in. It's so important. How are things? How are you? Little check-ins and having fun. Great. Thank you, Barbara. Lori?
Mine's a little bit different. Mine is when you get your prescriptions, have the pharmacist give you a pill bottle with the prescription on it that's empty, so that you always have your prescriptions with the exact dosaging to have with you. And when you do, so that you have those in the car with you at all times, so that if any emergency ever happens and you go into the, you have your exact dosaging for it. And when you do your when you refill your meds every week, make sure that you update, that your med list is updated every single week, and have that with your meds. Because if a Parkinson's patient ever has to be hospitalized, sometimes they don't have the Parkinson's meds for you. So it's always a safe practice to have your own meds to go with you into the hospital, because you don't want to have to wait for them to get the meds for you. You are able to give the meds immediately. And it saved us, I can't tell you how many times, to have that practice. So always just ask the pharmacist to give an extra pill bottle with the prescription. There's nothing in it. It's just the dosage. It's just the dosaging of what they're taking. And that way it's an extra set, you don't have to remember they can read the bottle. And that saved us so much. We learned that in the Aware and Care training. And it was a godsend. We always had a bag that we kept in the car at all times with the meds, and that went with us wherever we went, with a spare set of clothes. So that is my big tip of what saved us.
Thank you, Lori. And you can learn more about hospital preparedness, hospital guidance, how to be prepared for emergencies, just by visiting the Parkinson's Foundation's website. Tons of information for you to collect and obtain, and resources that you can put, like Lori said, in your car, in a bag, getting ready for what can be unplanned. We're trying to wrap us up so we can all go. Dr. Bayram, any final thoughts as far as the one tip, the one tool that you wish to share with our community?
I think everyone covered amazing things, so I'll just add, with or without Parkinson's, we get such limited time with our loved ones in this life. So I think just cherish your moments with your loved one, with or without Parkinson's. Spend time with them, spend quality time with them, and create more memories with them. They may not be able to function as they used to before, but they're still your loved one. Cherish the moments you get to spend together.
Beautiful advice, Dr. Bayram. Thank you so much. And thanks to all of you, Tom, Lori, Barbara, for sharing your expertise with us. You three are the experts here, right? Dr. Bayram and I are here to support the conversation, keep us on task, and to ensure that everyone feels heard, and that your unique experiences in some way are shared with our community, so we can continue to instill the sense of belongingness across the globe. So thank you all so much for your support today. When a loved one is diagnosed with Parkinson's, it can bring unexpected changes that may involve learning new skills, adjusting daily routines, and navigating emotional ups and downs. Every care partner's journey is unique. The Parkinson's Foundation is excited to introduce our new Care Partner Guide, designed to offer support and encouragement. It features 5 wellness keys with practical tips, insights, activities, and resources to help care partners at every stage of their journey. You can view or download the guide in the PD library at parkinson.org/library. Print copies will be available to order online from the store in December. The Parkinson's Foundation is proud to offer PD Health at Home, a virtual program series designed to provide education, wellness, and community support directly to your home. Each week, we host a variety of sessions tailored to enrich the lives of those affected by Parkinson's and their care partners. You can join us on Mindfulness Mondays, Wellness Wednesdays, Fitness Fridays, our expert briefing series, and our Spanish programming, EP Salud en Casa. Learn more about what we have coming up by visiting the webpage and check out our archive videos on YouTube by scanning the QR code. Parkinson's Foundation is proud to be a partner in a new NIH-funded study exclusively for family caregivers of people living with Parkinson's disease with cognitive change, hallucinations, or dementia, or people with Lewy body dementia. This study, called Persevere, is entirely virtual. Persevere was created to try and understand whether and how a disease-specific caregiver-centered educational intervention can improve caregiver knowledge, confidence, strain, and health outcomes. You can learn more about the study by visiting the Persevere website here, scanning the QR code, or emailing the study team. That information is on the slide. And PD Generation, Mapping the Future of Parkinson's Disease, is a global research study that provides genetic testing and genetic counseling at no cost for people diagnosed with Parkinson's disease. By joining PD Generation, you can discover your individual connection to the disease while helping map the future of tomorrow's breakthroughs. You can share this opportunity for advancing research towards a cure with your loved one living with Parkinson's. And I have to acknowledge we had so many meaningful and thoughtful questions today during our final Care Partner Summit of this year's webinar series. We were not able to answer them all, so please do not hesitate to reach out to our helpline, 1-800-4PD-INFO, or email us at helpline@parkinson.org. Our website, parkinson.org, is also a beautiful resource for you to tap into. I thank you all for advocating for yourselves, for being present in this journey, and for making time and space just for you. Let it be easy, let it be fun, and continue to celebrate the times that we get to share with one another. Until soon, be well.